Myself, Dr. Hitesh Nathani, and I am the anesthesia educator on this wonderful platform of Unacademy. I take the concept and I take the subject of anesthesia and I simplify that concept, make it fun, loving, interacting, and scoring for you guys. So let us begin, and let me first at the outset tell you that at Unacademy we are coming up with a medical marathon for the particularly mid-year examination targeting your AIIMS, NIMANS and PGI. Will be beginning from the 9th of March and it will be going on for straight 7 weeks up till the 26th of April. Yes. Now AIIMS, unlike any other exams, has become more competitive in terms of like other competitive examinations. Now it has got different aspects, different types of questions. We'll be targeting each set of questions pertaining to every week. All the 19 subjects will have same type of questions every week, and week after week we'll be dealing with all 7 types of questions which are asked into the AIIMS examination. Week 1 will be single best answer type, then followed by multiple true false, then match the following, sequential assertion, multiple completion, assertion reasoning type, and extended match the following type. Yes, to sign in, my referral code is Dr. Hitesh. So today we'll be discussing the assertion reasoning type of questions when it comes to anesthesia as a subject. What do you mean by assertion and reasoning? Yes, assertion is nothing but it is a statement that is made out, and reasoning is the explanation for that statement. Yes, first you should know what is this type of question, and once you know what are the types of questions, the basics of that, why it is actually that type of question, then you will be able to actually solve it. Yes, assertion is a statement and reasoning is the explanation for that statement. Yes, it is a type of verbal reasoning type of question. Okay, so let us begin with our question for anesthesia subject. Assertion here is extension of neck and flexion of head helps in ventilation. Yes, whether it is true or false, we'll come to it. Whether the assertion is correct or whether it is not correct, we'll come to it in a while. What is the reasoning here? The jaw thrust removes the tongue from the posterior pharyngeal wall. So what is the statement that the examiner is making? That by extending the neck and by flexion of the head, it will help in ventilation. Yes, and the reason for that assertion is because of the jaw thrust, it removes the tongue from the posterior pharyngeal wall. What are the options that we have been given? Both assertion and reason are true, and the reason is the correct explanation. Both assertion and reason are true, but the reason is not the correct explanation. Assertion is true and reason is false. Assertion is false but reason is true. And the last option is both assertion and reasoning are false. Now, what is this pertaining to? It pertains to the airway part of the anesthesia. Yes. How do you manage the airway? Now, looking at this thing, first we should know what are the different types of maneuvers that we perform on the airway in order to ventilate the patient in a better form. So what do? You do chin lift, you do head tilt, and you perform jaw thrust maneuvers. Yes, you perform these 3 maneuvers when you want to like ventilate a patient, when you want to open up the airway. What happens with chin lift, head tilt, and jaw thrust? Your tongue, which is falling onto the posterior pharyngeal wall, it is lifted up and the airway is completely open and you are able to ventilate the patient. Yes. So now, as the question here is asked, extension of neck and flexion of head. What are we gonna? What are we doing here? What is happening here? Here there is extension of neck happening, or there is flexion of neck happening. Yes. What is that position called? It is called as sniffing position. Yes. What happens in this position? It is also called as morning fresh breath air of breathing air. Yes. So in this sniffing position, there is flexion of neck. Yes, so in this sniffing position, there is flexion of neck. And what is the assertion here? There is extension of neck and flexion of head. It is exactly opposite. There is extension of head and flexion of neck. So this is called as sniffing position, which is the position that we perform first before we want to ventilate the patient and before actually doing the laryngoscopy. So is the assertion correct here or is it false? So here you should be able to answer that, yes. And what about reasoning? Jaw thrust removes the tongue from the posterior pharyngeal wall. Yes, jaw thrust does remove the tongue from the posterior pharyngeal wall. That is one of the maneuvers for that airway management. What happens, especially in cases of trauma patients, where you are suspecting a cervical spine fracture injury, yes, cervical spine injury, in that this chin lift and head tilt maneuver are contraindicated. You cannot perform this. Why? Because this will aggravate the cervical trauma. So what do you perform there? You perform the jaw thrust maneuver, where only that maneuver is performed, which will help in lifting the tongue from the posterior pharyngeal wall, and you will be able to ventilate the patient. So the assertion that is being said here is incorrect. So what is the correct option here? That is assertion is false. So which is the one which is saying that assertion is false? That is option D and option E. Both of them say that assertion is false. Coming to the reasoning part of this, jaw thrust removes the trunk from the posterior pharyngeal wall. So assertion is false, but the reason is true. Only one statement here which has been mentioned is true. So which is the option which says assertion is false and reason is true? So the correct answer here is option D. Yes. So this was the question which was asked in the previous year's examinations, and this is how the questions are asked nowadays. It has become more competitive, and with different types of question, you should be able to answer in a very conceptual, competitive manner. Yes. So in this question, the assertion is false, but the reason for that assertion is true. Yes. So this is how we come and we explain every topic when it comes to anesthesia as a subject. So let's crack your anesthesia. Let's crack the AIIMS examination. My code is Dr. Hitesh. Let's crack it.